is Kevin Ryan. I am an osteopath and acupuncture practitioner. I was one of 6 very fortunate men to learn from the late Thomas Ambrose Bowen, an osteopath also in the Geelong area and the founder of the world famous Bowen Techniques. These techniques are simple, easy and profound. They are simple in concept, they are easy to learn and to master with practice, and they are often profound in their results. So welcome to a demonstration of one of these techniques. The technique that I've chosen is that of the forearm. Forearm strains and dysfunctions are common presentations and co-presentations in clinic. The forearm is a complex structure with 2 long bones extending from the elbow to the wrist, the ulna and the radius, with a web of interosseous ligaments holding the bones together and apart. There are a number of supporting muscles, and together this structure allows for motion or function of the forearm, the elbow, the wrist, the hand and the fingers. One of the features of Tom Bowen's work was his ability to simplify complex structures into key areas of dysfunction. When these primary areas of strain were addressed, many of the painful syndromes of those structures would resolve. The complexity of forearm strains, sprains and dysfunctions was simplified by Tom into problems associated with the tone of the interosseous ligaments between the radius and the ulna. His approach used trigger points on what we know as the Yang-Ming channel. This is what the technique looks like. It's easy, very simple, and quite profound in its effects. If this were being taught to mechanotherapists such as chiropractors, osteopaths, physiotherapists, and myotherapists, then what they would be interested in would be trigger points associated with the brachioradialis muscle. Now, there are very few trigger points associated with that muscle, but what we know is that there are 8 points on the arm Yang-Ming channel, the large intestine, that can be useful. The first of them is about 2 cm from the elbow crease on the line between large intestine 11 and large intestine 5, known as large intestine 10. About 2 cm down, so we start there, and it's just a matter of rolling through that tissue, getting a flick sensation, and then working our way down through those known points. Now, there are also 3 very important master tung points called chi points down at the lower end of the arm, just above the wrist. These 3 points are also used in the technique. So once again, it just looks like this. Very simple and easy. The arm is then rested for about 30 seconds or so, and then you can proceed with wrist techniques, thumb techniques, finger techniques or elbow techniques as is required.